Hey everyone, welcome back. My name is Dr. Karthik Iyer. I work with Residency Medical, and we have another high-yield case for you, another interesting one. So we're going to start with a 24-year-old female who's an avid hiker, loves to go hiking. She's from the northeast of the United States, and what she has is a constellation of symptoms. One, she has a fever, she has chills, she has a myalgias, meaning muscle pains, and she also has a rash, as you see on the picture. She has no other medical problems, no medications, and no other pertinent history. Vitals are stable, and what we want to know is, what do you think the diagnosis is, and how do you treat it? Comment your diagnosis below, like and follow, and come back tomorrow for the answer to this case. Were you able to figure out what the diagnosis was? I hope you were. If not, the answer was Lyme disease. Lyme disease is caused by Borrelia burgdorferi bacteria. I know it's a mouthful to say, but this bacteria is a very high yield illness because it's associated with the ixodes tick. On top of that, you can get more symptoms than what you saw in our case for Lyme disease. On top of the rash, which looks like a target shape, that's why it's called a target rash, it's also known as erythema chronica migrans, that's another high yield point, and that's pathognomonic for the disease. So if you see the rash, you know you have Lyme disease and you can start treatment immediately. But additional symptoms when it gets more and more severe include arthritis, severe arthritis, especially of the knee, that can be pretty damaging. You get bilateral facial palsy, so the cranial nerve 7 palsy, what Justin Bieber has right now actually, you get it on both sides. And the treatment for this depends on if you're a child or an adult or if it's severe. If it's a child, you want to avoid doxycycline because doxycycline can cause damage to the teeth and the bones. You want to avoid that in kids. You want them in healthy teeth and bones, right? So you give them amoxicillin. For healthy adults who don't have any issues besides the Lyme disease, you can give amoxicillin or doxycycline, usually preferring doxycycline. And if it's very severe, such as having heart block, Bell's palsy, or severe arthritis, you give IV medications such as ceftriaxone. I hope you learned a lot from this case. Don't forget to comment, subscribe, and like, and I'll see you next time.